like to thank everyone here today for being part of this prestigious symposium. I believe your energy is crucial to the future of excellent and equitable care.
The experience this past weekend at FSDR has been awesome. Energizing to be able to be around everybody.
It's a very exciting time to be involved in the care of patients with sickle cell disease. The talks, the interactions, the conversation, the listening at this meeting reflect that.
My experience at the symposium has been outstanding. I've been to several of the FSCDR meetings in the past, always at a great venue. Gives me the opportunity to see people who I don't see that often. It gives me the opportunity to get information on the latest and what's going on in the world of sickle cell disease, what's going on in the world of research, what's going on in the world of drug discovery, drug development.
I encourage anyone that's involved in sickle cell disease, even if it's just a community advocate, to be able to come, listen, learn, and be a part of the dialogue.
This is the 16th year. When I first started this symposium, it was to educate the doctors at my local hospital where I worked and set up a sickle cell program. They didn't know a lot about sickle cell, so I knew that the best way that they learned or at least accepted information about sickle cell was to be in a room with their colleagues. So I invited all their colleagues to come to Florida in February, and voila.
It's been outstanding. Meeting all the people who care for patients who have sickle cell and their families, who are looking at research in every topic, from how do they prevent pain, how do they treat sickle cell. It's just outstanding.
This is my 16th year attending this event, and I attend this event because there's so much new information and so many minds here that want to talk about sickle cell disease and really want to impact the lives of patients living with sickle cell disease.
This was great for me. It was like a reunion, and I really enjoyed it. People that I'm friends with online, people that support sickle cell in other parts of the country. I had an opportunity to be with them and spend time, quality time, and learn.
FSCDR has impacted my career in many ways. What FSCDR does in the South Florida community is probably unlike any other place in the country. The relationship they have with their patients with sickle cell disease, the services they provide, the education that they bring to the forefront of the community has been very impactful in terms of helping me understand the plight of patients with sickle cell disease.
You know, this is a unique conference. It has something for the common person, for the patient, patient's family, medical students, physicians, and of course specialists in the area of sickle cell anemia. And in fact, this is what the discipline needs. We need to be able to educate the common person.
You know, FSCDR, really just hearing about the setup and talking to the people that have built the program down here has been really inspirational and given me a lot of ideas.
What we've done is put the information out there, so if I need to go home and do my homework and read up on it some more, or a patient needs to do the same, they can. It's a multiple learning experience. It's not a one-way learning experience with the speaker telling the audience something.
You get to meet family members that have sons and daughters that have sickle cell. So just being in an event like this is very beneficial to everybody, including healthcare professionals. Because you may have a patient that has sickle cell, but hearing from other professionals and also seeing what researches are out there.
This is the place to be to learn, make connections, and definitely network.
Been coming to FSCDR for many years now, and it's good to learn about different things that are happening in the field. So learning from your colleagues, learning from your patients, and just bringing everyone together to think about how can we improve care for our patients.
I'm ready to come right back. I wish we could do this more often. Again, the knowledge and the time that people have taken to really learn about what's happening out there, it's been an eye-opener, and I can't wait to come back.